Silva, you talked about kind of intrapersonal psychological processes. And I'll complement this, I think, well by talking about two other circles around the individuals. One is the relational circle with one's parents, and then also the circle of developmental stages that has different demands on the individual that can influence emotions as well. And I want to talk to you about something that is very dear to me, not only as a researcher, but perhaps mostly as a clinician, which is removing the good and the bad from attachment theory. And I want to ask, together with you, whether insecure attachment can confer emotional benefits. And this is not a straw man argument to say that insecure attachment is often thought about not as the greatest thing on earth. If you look at psychology today, at the height of the pandemic, it's an online news article that millions of, at least Americans, follow and download. Its article saying something like this: why are some people non-compliant with stay-at-home orders? Remember, at the COVID times? Well, the answer might be this: insecure avoidant attachment may drive non-compliance. So beware of those insecure folks. If you look at Healthline in 2020, at about the same time, talking about attachment theory and what role does it play in relationships, here is how you can make sense of attachment. You can let disorganization, and that would be those people who are erratic and unpredictable. And how do you note insecure avoidance? Well, these are the people who have no feelings at all. But don't you worry, because 2 years later, we have another news article by Psychology Today. It says, how to become more secure person. Okay, so it's not the end of the world. We have mechanism of changing your security such that you'll be healthier. And then The Atlantic in 2023 diagnosed Americans as really at one of the worst eras. It's an insecure attachment era where people have difficulty with intimacy. So you can certainly see that when it goes to the public, by and large, insecurity is something quote unquote bad as far as mental health is thought of. But in research, although a little and far in between, we know that sometimes insecurity can confer some benefits. For example, in 1996, Jay Belsky and his team showed that insecure infants who were classified as such at 12 months, at age 3 had better memories for negative events compared to positive events, a phenomenon that he did not find in the securely attached group. Now, you may ask, why do we want to remember negative events? Well, it depends on the context, but it's not necessarily bad. Sometimes you actually want to remember negative events in order to avoid making the same mistake twice. Those of you who are interested in adults, you can look at Aindor and Perry in 2014. Again, depending on the context, being heightened or having higher attachment anxiety scores compared to having lower might confer some benefits. It would allow you to detect deceit a little bit better than those who are securely attached. And so if you're a poker player or just want to know whether your partner is cheating on you, perhaps you want to have a little bit of attachment anxiety. And in 2023, and this is pertaining to mental health, Hill showed something very interesting. It's not always good, quote unquote, to be securely attached. Look at what happens to those folks that at age 1 were exposed to violence at home. Here on the x-axis, approach factor as coded via multiple scales in the strength situation paradigm. And the higher the approach toward the parents, and we'll get a little bit to details in a minute, but those who might be considered seeking proximity at a heightened rate and intensity, which one might think confers benefits. But 12 years later, these folks reported to have significantly more depression compared to those who were not as seeking proximity to parents as those who have heightened seeking proximity. So again, security might not always confer benefits. Today, I want to talk about not secure versus insecure. I want to talk a little bit more about types of insecurity and how they, depending on the developmental context, might confer benefits emotionally. I want to talk about deactivating and hyperactivating strategies. That's the language I'm going to use today, and hopefully it will make sense in a minute. And the main argument that I want to make today is that vulnerability to internalizing symptoms. This is mostly comprised of depression and anxiety. That's the interest of today. That depends on the interactions of at least two factors, two of which I'll focus today. One is the type of insecure attachment, and two is the developmental stage in which this insecure attachment strategy, I would call it, is performed or assessed. And I want to use the developmental mismatch hypothesis to try to explain and develop testable questions, research questions, to make sense of this differential predictability of the insecure types on depression and anxiety. And one main thing that I want to keep in mind today, as we move through the slides, is that, at least for today, I want to adopt an idea that psychopathology symptoms, this is of course not something that I came up with, definitely something that I adopted from people in the field for years now, definitely in the psychoanalytic world. Psychopathology symptoms today, I want to refer to them as unintentional products of early life adaptations to higher order goals. When we come to this world, we are not necessarily thinking first and foremost about how to be happy, we're thinking about how to be safe. And once we adapt to the earlier caregiving environment, we might feel depressed or anxious, or not so much, depending on how can we manage safety around our early attachment figures. So in order to talk a little bit about attachment and insecure attachment and how it's associated with depression and anxiety, I have to take the impossible task of talking about attachment. So I'm going to try to do it in about 8 to 10 minutes, because I do think that it will give you some idea, for those of you who have not been exposed to these ideas, of why some individuals are more vulnerable depending on their attachment strategies to depression and anxiety, depending on the stages in life we assess them. So Bowlby thought about attachment as being strongly disposed to seek proximity to and contact with a specific caregiver when one is frightened, tired, or ill. And he thought about it as a lifelong strategy. We have attachment needs that are activated from the cradle to the grave. He proposed that we are the happiest when life is organized. It's a series of excursions from the secure base provided by our attachment figures. Now, those of us who are classified as securely attached have something in the back of their mind, a set of expectations that looks something like this. At times of need, when the attachment system is activated, we expect to go to a caregiver. We expect that caregiver to instrumentally, but most importantly, emotionally take care of us, such that we are relatively quickly soothed and going back to do whatever we did prior to the onset of the distress. Right? How does it look like in the strange situation paradigm? Let me introduce a few screenshots that might tell a story for those of you, again, that might not be familiar with the strange situation paradigm, which is really a procedure that takes about 20-21 minutes and include a couple of separations and reunions of children and their caregivers, and are coded mostly from the viewpoint of the child's behavior at the time of reunion with the parent. This is how a child looks like when a parent leaves. Okay, quite distressed, right? The expectation is, and it's not conscious, that if I behave this way, if I cry and make a fuss, I'll get my parent to come back, right? So this is the expectation potentially underlying this behavior. When we send a stranger into the room, not the parent, it's very clear that I need my parent. I don't want the stranger, as manifested here, as still being quite distressed. When the parent comes back, and this is a screenshot from about 25 seconds after the parent is back, the parent sits here, and what does the baby do? The baby goes back to explore the physical environment, which tells us something about being able to use the parent's presence to go back and do whatever I did prior to the onset of the distress, right? Now, in normative population, this is, give or take, about 50 or 55% of children, which gives space to the other 50% of children that might be insecurely attached. And briefly, I want to talk about how we think about those. Some children are thought to have parental rejection, experience parental rejection at times of need. Every time I cry, my parent either ignores me or completely rejects my bids for help. That leads to limited support seeking, because why would I want to continue to ask for support if I cannot get it? Which we code as insecure avoidant. How does it look like in the strange situation? Something like this. A parent leaves, whereas the child looks at the parent leaving, there is no clear emotional signals of I need my parent back. when the stranger is back, there is some level of playfulness with the stranger, as if this is good enough. Again, not emotional cues to say, I need specifically my caregiver. And when the parent is back, where is the attention? The attention is away from the parent, right? I'm going to look away from my mom, potentially to not piss her off, potentially to maintain some proximity such that it's good enough, potentially not using extra efforts that I already know are not going to be successful. Some infants experience or thought to experience inconsistent caregivers. Sometimes my parent will be there, but sometimes not, which leads to excessive support seeking. If I do have a belief, although doubtful, that I am able to solicit support from my caregiver, but that requires quite a bit of proximity seeking, and I want to make sure that my parent is going to be here when I need them, I'm excessively showing them I need them. And that is coded as insecure resistant. Some screenshots to show us what it means. Here is a dad that just leaves the strange situation. Paradigm room, this is a clear distress by the infant. I'm not happy when dad is leaving me. Here's a stranger coming back. I'm still not happy. There's almost like a sign, universal sign of a hand on the mouth. What a horror. That's not good. I don't want that person here. I need my dad. But when dad comes back, and this is a screenshot that is taken about 2 minutes after the dad is already back, where's my baby? The baby is not leaving the dad, and the behavior is, oh my God, I'm still distressed, and I'm definitely not going back and exploring their environment like the securely attached infant did, because I'm doubting that if I'm letting dad go, perhaps he might not come again when I need him. Okay, so here it's an excessive attention towards the parent, just not to lose their sight again. I need to maintain this proximity at any cost. And then there are the disorganized infants that I will talk a little bit less today about, who are thought to have caregivers, at least one of them, that provide them secure base to go to, or safe haven to go to, but at the very same time can also be a source of fear. So what do I do? Do I go to parent or do I not? If it's unclear to me as a baby which parent I'm going to find, the fearful parent or the one who's going to be there for me, then I thought to be a breakdown completely of the coping strategies, which is called disorganization. And here I'm just going to show you one screenshot. It's a screenshot of a baby from the 70s from Haifa University that froze, or one would say kept still in this position for nearly 3 minutes. I don't have to show you anything else. Any baby that looks like this when mom leaves and comes back probably is going to be disorganized. Now, the question is what's going on in the mind of such a baby. Potentially, I don't know if I want to approach or to get away from mom. So this is the best solution. I'm just going to stay still at the very same place. All of these insecure attachment patterns are thought to lead to emotional problems. Why? Bowlby tells us, at least with respect to anxiety and depression, why. And Bowlby Boys still is one of my heroes because he did not focus on the problem. He focused on who is next to me dealing with a problem that might lead to psychopathology. When he talks about anxiety, he talks about the expectation of close others being unavailable at times of need. This, and not the specific fear, is what he thought as propelling and maintaining vulnerability to anxiety throughout the lifespan. Depression, same thing. It's not about what happens to me that I'm sad about. It's about realizing, based on repeated past experiences, that a caregiver of mine is not going to be there for me to help me deal with whatever comes to mind, whatever life suffering is going to manifest as. When these efforts are futile, I'm going to be helpless, right? I'm going to be depressed. Today, I'm going to talk a little bit less about the disorganized category, mostly because it was not found to be significantly associated with internalizing symptoms compared to the securely attached individuals. I will talk about the insecure types. And I will use a language that was used before me, but I love adopting it because I would want to talk about attachment in adults, and I think there is a strong common denominator. I want to talk about deactivating attachment strategies, which we can think about those infants who excessively show decreased proximity-seeking behaviors at times of distress. Remember the insecure avoidant baby who looks away? That is the deactivating attachment strategies. And I want to talk about hyperactivating attachment strategies, or those infants who excessively show increased proximity-seeking, excessively increased proximity-seeking behaviors at times of distress. Now, these are infants. I want to talk about attachment throughout the lifespan. How do we measure it in adults? We use the adult attachment interview, which is about an hour, sometimes less, sometimes more, interview that consists about 20 questions about your caregiver experiencing earlier in life and how they influenced who you are today. And in those interviews, we of course don't look at physical behavior like we do in babies, but we look at linguistic behavior. And I want to show you a couple of examples of how this linguistic behavior is also can be thought about very much as hyperactivating and deactivating of attachment strategies. Remember that baby that looks away, that direct attentions away from the parent. How does it look like in language? Here is one question that we ask as a follow-up. We asked about 5 adjectives or words that describe your relationship with your parent. Here is one adjective that was chosen by a participant, the adjective close. Sounds positive. Follow-up question is, what comes to mind with respect to close? We ask. Any occasion or instance that comes to mind? Here is the answer. You know, mom, the question is about mom, just confided with me with a lot of, things. It's very hard to describe something that's been or have one particular memory. Because it's always been very continuous and very, So we call it an incoherent discourse, but really what's interesting to our talk today is that there is an attention that is directed by this interviewee away from the memory of the parents, right? Potentially distressing memories of the parents. Otherwise, and the thought is, why would you not talk about those relationships if you describe them as close? It's supposed to be something warm and fuzzy. Okay, so here the attention is directed away from the caregivers, kind of rejecting the question, rejecting the interviewer. So we can think about this as deactivating the attachment system as manifested in linguistic behavior. How does it look like when we think about hyperactivating attachment? This baby that excessively proximity seeking to the parent and maintaining this proximity seeking, proximity to the parent. Here is a question that we ask in other participants in the interview. Have you ever had experiences that you would regard as potentially traumatic? This is the answer. We're not going to read it, but you get the idea. There is an excessive attention towards the memory of the parent. Now, if you look at the content here specifically, you would see also a lot of anger, which is also a sign of hyperactivating attachment. You can also sometimes see fearfulness of the parent, and also sometimes see something that some of us, that the coding talks about as passivity. Someone who is very engaged with the parent and the memory talks a lot about that, but is really incoherent, kind of makes up even sometimes words that are unintelligible. We don't understand them, but it's clear that they are overwrought by emotions. They are emotionally excessively engaged with the negative memories. This is how it looks like in language. So in adults too, we see deactivating and hyperactivating attachment. Now I'm not here to talk about attachment per se. This is not a lecture about attachment. I have people here that know much better than I do about attachment. But what I do want to talk about is about several meta-analyses that measure the association between attachment security and the different type of attachment insecurity and internalizing symptoms, including depression and anxiety across the lifespan. So what do they show us? Let's start with adults. Why? Because in 2018, as I about to end my graduate studies, I was interested as a clinician to speak more informally about treating, quote unquote, patients, again, quote unquote, and making them more secure. I wanted to make an argument for that. How about we do a meta-analysis or update meta-analysis from the past that looks at adult attachment interview classifications and the different insecure attachment, and look at depression and anxiety. Now, x-axis, this is the secure attachment. Okay, so everything that I'm about to talk about is compare the symptoms of depression and anxiety to securely attached individuals. This is what we expected, and these are effect sizes on the y-axis. We expected to have small to medium effect sizes, different such that those who are use deactivating attachment in the interviews, and those who use hyperactivating attachment strategies in the interviews will show significantly, as manifested in the asterisks here, significantly more depression and anxiety compared to the securely attached individuals. That's the theory by Bowlby, and that's what we anticipated finding. But that's not what we found. What we found was true based on our expectation only for the hyperactivating individuals. But those who were deactivating actually did not self-report. In a sample of between 4,000 and 5,000 adolescents and mostly young adults, and about 50 samples, there was no significant difference in depression and anxiety symptoms for those who were classified in the adult attachment interview as using deactivating attachment strategies. And there was a significant difference between those groups as well. So already some divergence from the theory. At the very least, at least when people report on psychopathology symptoms. What happens in childhood? Let's go back to those strange situations. In childhood, it's a completely different, maybe the mirror opposite findings. Only those infants who show deactivation during the strange situation paradigm, their attention is directed away from the parent, are reported by their parents or teachers to have significantly more internalizing symptoms, comprised mostly of depression and anxiety, compared to the securely attached, but no significant difference when you look at hyperactivating attachment strategies. And there was no significant difference between those two groups. Another meta-analysis by Ashley Groh et al. Showed very similar results, although the effect size were just a little bit smaller. So let's put it all together, okay? And what do we know meta-analytically today about insecure attachment and depression and anxiety? Earlier on in life, it is the deactivating attachment that confers heightened vulnerability to internalizing symptoms. But later on in life, post-childhood, when children become at least adolescents and are able to go through the interview and show linguistic behaviors, here it is the hyperactivating strategies that confer emotional deficit or vulnerability to depression and anxiety. So one may think about this, and this is, of course, we're not talking about the same individuals, but it is potentially the case that there are emotional benefits to being or using insecure attachment strategies, but it really depends on the developmental stage in which you assess them. If in childhood, potentially, it's not all that bad, quote unquote, to use hyperactivating strategies as far as internalizing symptoms are concerned. Later on in life, it probably will be a problem. However, if you look at the deactivating attachment strategies earlier on in life, it will show heightened depression and anxiety compared to the securely attached individuals, but might confer emotional benefits when you move into adolescence and young adulthood. So what's going on here? Now, before going into theories and putting together some testable research questions, we have to take into account methodological consideration, and I'm intentionally going to go through them quite quickly. First, of course, we have to acknowledge that there are different informants of the internalizing symptoms. Earlier on in life, these are the parents and teachers that report on the children. Later on in life, we report by mostly on ourselves. It's a self-report endeavor. Different phenomenology of internalizing symptom is something that clinically is very important. Sometimes you might suffer from depression earlier on in life, but it manifests as what sometimes from the adult point of view may look like aggression or externalizing behavior. So it might be the very same diagnosis, but looking a little bit differently. So that might also pose some threat on what I'm about to suggest. And also the assessments of attachment patterns, although I used language that I do think pertains to a common denominator between attachment assessment across the lifespan, it is not the very same assessment. Earlier on in life, which is observations of infants moving in a room or not so much moving with parents, and later in life, linguistic behavior. But a phenomenon that is complex as this might require some theoretical underpinnings, especially because the predictions were not met, not in childhood and not in adulthood. Insecurity is not all bad. And with that, we, a couple of years ago, developed the lifespan development theory of insecure attachment and internalizing symptoms. And we used the developmental mismatch hypothesis to try to explain them. Now, what is the developmental mismatch hypothesis? Two things that I want us to remember. One, the idea that early experiences shape effective cognitive and behavioral development. And secondly, there are differences in stressors throughout the lifespan, and if they occur, that might cause risk to experiencing disease, difficulties or mental illness as well. Okay, so it's not so much the strategies or the adaptations early in life, but rather the social environmental context in which these strategies are developed that might either change or stay the same, and that this interaction might tell us a little bit more about one being vulnerable or not so vulnerable to internalizing symptoms. Now, why is it important to us? Because number one, as I'll show in a second, it highlights the crucial role of the social developmental environment. All of us live life, if we survive, through childhood and adolescence and young adulthood. And that entails something very important that I want to talk about in a second. Also importantly, mismatch is thought of as something that it can go either direction, right? It can be something that earlier on in life have one specific environment but changes later on in life. So adaptation early on in life become maladaptive later in life. But it can also be the case that earlier on in life, you have maladaptation that becomes adaptive depending on the context. I want to explain how it looks like right now. Okay, so what do we propose? First of all, let's think about the dominant support figures, early in life and later in life. Early in life, of course, we know that we have to come out as we're born through the birth canal, and we're born really premature. We're really helpless. We need caregivers. We need to make sure that they're proximate to us. We need to make sure that they are by our side dealing with whatever problem there is in life, if only to survive and reproduce. Later on in life, the goals might change a little bit. Why? Because it's totally normative in many cultures, definitely in Western cultures, that non-parental figures become the dominant support figures. In fact, if you think about this, the autonomy aspect that is many times for those of us who are clinicians is heightened or highlighted in interventions becomes very important. How do we become autonomous? We develop relationships other than parental relationships. We develop relationships with peers, we develop relationships with romantic caregivers, and although the relationship with parents is not severed entirely, we have to do that in order to become healthy adults in our society. Accordingly, what are the appropriate orientation tendencies? If parents are the main support or the attachment figures earlier on in life, we want to make sure that we have it in our system, the strategy, to tend towards them, especially at times of need. So the appropriate orientation tendency at times of need is towards caregivers. Post-childhood, when we seek independence, when we seek developing other relationships with other potential attachment figures, the appropriate orientation tendency is away from parents and towards greater independence. And those of us who have the flexibility to move between towards and away from parents throughout the lifespan can be thought of as securely attached individuals. Right? We can use the parents at times of need, but we can also use them as secure base in order to go out and explore other relationships and become independent adults later on in life. Let's look at what happened in the hyperactivating attachment. It may be the case that earlier on, and remember, hyperactivating strategies early on in life is hitting the target of orienting towards parents, although it does it excessively. Remember that infant that would not leave the dad? There are some unintentional emotional downsides for this, but the main task early in life, which is to be closer to a parent, is achieved. And therefore, there is a match between the strategy that was developed early on in life and the demands or the appropriate orientation tendency that is expected in childhood. When we move to adolescence and we seek peer relationship and romantic relationship, but we are rigidly excessively attending our attention to our parents, we might have a little bit of a problem and definitely a mismatch with the orientation away from them. We might be enmeshed with parental caregivers, and also those strategies might be generalized to other relationships, which is not always a great idea. If I'm excessively seeking support from my parent and do the very same thing with peers, it's not looked at very favorably by others. When those adolescents who enlist everyone in the world through text to be with them at times of need, even if their distress is small, relatively small, it might pose difficulty on them in order to develop other relationship and romantic relationship as well. There are multiple studies that show that it is those individuals, not the deactivating individuals, that not only want relationships or a romantic relationship more, desire them, but also experience the most dissatisfaction in those relationships. And you can imagine potentially why. What happens with the deactivating strategies? Earlier on in life, and remember, the adaptation is happening either way. They adapt to the early caregiving environment by looking away, by attending away from the parent. But a few years later, we enter school years, age 5 or 6 or 7 or 10, and this is quite an omnipresent phenomenon to have all kinds of children's groups that might make you feel excluded. Bullying is also something that definitely we know today happens much more than we thought. And what happens to those children when they go back home? No, our attention is not towards dad or mom. Our attention is away from them, so we stay alone, okay? And this is the mismatch with the appropriate orientation tendency towards the caregiver. Ideally, those of us who are doing psychotherapy, it's really outstanding every time to see a child that suffers and close themselves in the room, not talking to anyone. That's not what you want in childhood. However, when you move to adolescence and young adulthood, potentially those individuals are so well trained in such strategies that all of a sudden what used to be maladaptive becomes adaptive because the social environmental context demands something different. It demands self-reliance, it demands autonomy, it demands leave your parents to some degree, start exploring other relationships. They might not be the most satisfying for those of us who are deactivating strategized, but at least we have other relationships that are expected to be developed later on in life as healthy adults. Now, how do we test this? Ideally, which is not easy to do, but this is the thought that we have. If we can get, and there are at least 2 studies that have such data that is available, individuals, and we can talk about potentially assessing them dimensionally, individuals who have heightened deactivating attachment earlier on in life, but for some reason or another maintain this deactivation later on in life, we would expect normative scores of depression and anxiety to go down compared to the securely attached individuals. And if we have those hyperactivating individuals that for some reason maintained rigidly those strategies into adolescence and adulthood, we would expect depression and anxiety normative scores compared to the securely attached to go up. So, some concluding remarks. First, I wanted to offer the idea that depending on the developmental period, childhood versus post-childhood, subtypes of insecure attachment may or may not be associated with internalizing symptoms. These are the facts coming out of meta-analysis. Right? It is potentially the case that insecure attachment relationships may confer, and I say unintentional emotional benefits, although some of it may come at the cost, depending on the developmental stage. Why unintentional? Again, according to this view, it's not that babies trying to make themselves happier earlier in life. They adapt to the caregiving environment to be safe. Some of us are lucky that it also allows us to be happy, but it's not always the case. And clinically speaking, it's always easier to work with adaptations versus with maladaptations. Oftentimes, I supervise clinicians myself in my position and supervise students. Oftentimes, as he talks about insecurity, is how do we adjust it? And my suggestion is to be a little bit more cautious with adjusting anything towards security, because sometimes insecure can confer actually quite emotional benefits. It does not mean that it's optimal, but you have to be a little bit more careful potentially in developing some interventions to some individuals in some developmental stages. And the last thing that I want to say and end up with this is potentially we need some in-house clinic to come up with something that makes a lifespan sense when we talk about insecure attachment and depression and anxiety before we relay the message to the public and clinicians as well. And with that, I'll end. Thank you so much.